Thank you. So we'll approve the minutes, and then we'll move on to Janine. Hi, Janine.
Good afternoon. Okay, on the 2/11/21 warrant, we paid Finger Lakes Business Services $2,291.89. We paid the American Commercial Cleaning Company for cleaning an apartment at Malone Village where we had a COVID positive case that was he couldn't stay in his own house because he had a brand new baby, and so we had to house him. We paid Nick Colas for computer support for our CDMS website. We've paid BioServe for disposing of our waste, both at Emerson Park and the clinics. We paid Schneider Laboratories for lead analysis. We paid Huga Community Health Network $65,974.63. They're our subcontractor for our Healthy Neighborhood grant, and their expenses were from April 1st of 2020 through January 31st of 2021. We also purchased 20 cases of medium gloves from Fisher for $3,599.74. And we've also purchased from Granger supplies for our immunization clinics that are now being held at Finger Lakes Mall. That's basically everything I have. Anybody have any questions?
Okay. I don't have any questions. Would somebody like to move to approve the claims?
Yeah, this is Batman. I move we approve.
I'll second it.
Okay, and Kathleen also wanted me to talk about the sliding fee scale for 1/1/21 through 12/31/21. Every year we bring in front of the board the fee scale that is what we will be billing people for immunization shots and the admin fees. We're looking into partnering with the hospital and Medent to start processing insurance claims for people that had insurance that went to our COVID clinics. If you had insurance, we are obligated to bill for the admin cost. And the Medicare rate is reimbursement rate is $16.94 for the first dose and $28.39 for the second dose. So we're bringing forth the fee scale so that we'll be able to set a fee where we can bill the insurance company. And then if they don't have insurance, there is no out-of-pocket cost or any co-pays for the vaccine itself. But because we are covered by state aid and we have to show a good faith effort that we are billing insurances if they have insurance. So we just need to set the rate.
Yeah, this is Keith. May I ask a question?
Sure.
If the insurance pays, does that money reduce our state aid or does it go to the county?
It reduces, well, kind of both. I mean, it would reduce state aid, but it would also be less that the taxpayers would ever have to come up with. So in the end, billing for it is certainly to the best interests of both the taxpayer and the county as a whole.
Yeah. Yes, yeah. No, I totally agree, and we should bill. That's not my question though. Is that the money does not provide additional revenue for us? It just reduces the amount that the state gives to us. Is that what I understand you saying?
Well, state aid is deficit funding, so we only get state aid after revenue.
Right. Okay. So that was my question. Thank you.
Yeah, state aid is deficit funding.
Janine, I have a question. It goes into our fees account, though.
Correct.
Yeah. And some of the work is 36% reimbursed, though. I mean, so the more fees the health department has, the less state aid they're eligible for. Is that true?
If we can back it up for a second, state aid,
Yep.
it covers a lot of programs, inclusive of communicable disease, which is in this case COVID. We get $650,000 annually to cover mandatory programs. We almost always have gone beyond that. So any amount we go beyond that, we get 36 cents on the dollar that we spend.
Right.
So revenue we generate, yeah, if it's enough revenue, it's less money we're expending in the first place. Hopefully we're covering some of our costs, but it will be less that we will ask the state for after we complete our $150,000 grant.
But generally, you use your state aid up before the first half of the year and then go to the 36% for eligible costs, correct?
Correct.
Yeah. Every year
Okay.
it's slightly different. We've always used our full grant, and then we get 36%. What is not covered, reimbursed to us in the 36% is local taxpayer cost, typically.
Right. Do you have the same obligation for COVID testing as you do for vaccination to try to get insurance to pay whatever?
Not that we've been told, but we did collect insurance information for that. We did the collection. The laboratories were billing for the analysis.
But we had not actually tried to go after insurance for any part of our COVID testing at this
Not
point.
for the collection part, no.
Okay.
And part of the FEMA reimbursement, we have to show whether people have insurance or don't have insurance. And so it's become really important that we know out of the list of people that we're vaccinating, who has insurance, who doesn't have insurance, and what we did to try and prove we build insurance.
Because FEMA wants you to maximize any revenue out there as well before
Yeah.
you claim against them. Okay.
Yeah.
Right.
FEMA is
And-
the last resort.
The last resort.
So it's a lot of tracking, Keith, also to that point. So, right, because FEMA's only going to cover certain things, but we have to have an audit trail that shows we attempted to cover through other means before we submit to FEMA.
Is there any sense that insurance companies say that they're going to actually pay this?
From what we've heard, that there are like new laws in place for COVID related expenses, and that they have to. So
Pay administration. Yep.
I want to say that there have been places that have billed Medicare, and I'm assuming they've been reimbursed, that they knew what the dollar amount was they got back. But I have a vaccinators call later this afternoon that I'll inquire whether there have been people who've been reimbursed at this point in time for administration.
So do you need an emotion to accept this proposed fee schedule? I'll motion.
I'll second.
thank you.
Okay, thank you, Janine. Alrighty. If nobody else has anything else for Janine, then we'll move on to Tanya.
Hi, everyone. I'll kind of keep on the theme of COVID, I guess, right now. So just to share, all of the WIC staff, full-time WIC staff, have been trained to help out with the COVID vaccination clinics. It's been actually a really good experience for most of the team here. to work with others and work with the public. It's looking like for the most part, we'll be able to help out mostly with weekends, weekend clinics, just due to the nature of having to manage the WIC clinic here as well during the week. A caseload update. So our numbers in January, 1,360 participants served. It's about 90% of our target of 1,500. Again, this year we were up about 4% compared to last year. January and February saw a little bit of a decrease in our show rate. I think that's pretty typical with a lot of programs, from what I'm hearing from other agencies, as well as tax season sometimes has an impact on participation with WIC and other services. But still, I mean, almost a 90% show rate, which is still great. It's March, so March is National Nutrition Month, so it's a big deal here at WIC. Our nutrition coordinator, Stacy, is sort of leading our theme this year. We're going with the American Academy of Nutrition and Dietetics. Their theme is Personalize Your Plate. So I don't know if you guys have seen that, but we're doing like a social media campaign. And then we're also asking all of our families to submit their own personalized plates. So pictures, recipes, anything they want to share with us. We've had almost 40 responses so far, which we were pretty impressed with. So hopefully we'll be able to compile all those and share them. We just had, well, the state is doing their virtual site visits this year. So it's sort of a 3-step process. The first step was an interview with the coordinator about some of the program policies. The next step, they listened in on appointments with nutritionists and support staff. So those 2 pieces are done, and they actually went pretty well for being something new for everybody. And then the last thing is just they're going to review a lot of our policies and procedures. But overall, it's been a pretty good experience. I did just kind of, I don't have too much to follow up on from last time, but we talked about, you know, losing a grocery store in Cato that no longer accepts WIC. I was able to reach out to the manager there. They're very receptive. I think they want to get back on board. They're just dealing with a little bit of a transition. So hopefully here in the near future, we'll work together and get them back on board. That's all I've got.
If I could add just a little bit more, I know Tanya and Nancy and some others have been involved in meeting to discuss the relocation of our WIC offices that ideally would have happened, except with I'll call it the parent company who bought the building. The construction costs came out ahead of what was originally budgeted. So we're doing some new planning and some new to keep it with manageable costs for all the parties that are involved. So that has delayed the move by a few weeks, and we'll have some new plans to look at and some associated costs, which then of course we'll have some further conversations with our committees about.
Okay, thank you very much. Anybody have anything else for Tanya? Thank you, Tanya. I guess we'll move on to Eileen.
Hi. So in your packet of material, you should have received some consent orders and hearings. So let me go over them. The first one is with Vape Cult, that they sold a flavored vape product to a health department inspector. They agreed to pay a $100 penalty and remove all the individual packages of flavored vape products from their store by February 26th. The next is with the Circle K, that when we showed up for an inspection, they didn't have any measurable free chlorine residual in the potable water supply. A boil water order was issued, the disinfection was restored, and 2 bacteria samples were taken, and they paid a $100 penalty. The next is with Cameron's Bakery, where one of our staff members observed a worker behind the counter inappropriately wearing face covering. They paid a $50 penalty for that. The next is a hearing with the Kyle property where the Kyles installed a septic system on their property in the town of Brutus without first obtaining prior approval from the health department. And so the hearing officer was that they should be fined $1,000. They should be ordered to submit proof that the structure being served by the sewage disposal system has been condemned by the code enforcement officer, or they shall install the previously approved sewage disposal system no later than May 1st, 2021, and all but 100 of the fine would be suspended if the above timelines are met. The next is the Marcella property in the town of Aurelius, where they had a failing septic system. The hearing officer ordered that the owner should be fined $1,000, should be ordered to submit engineering plans to install or repair the sewage disposal system by April 30th, and then install the approved system within 60 days, and all but 100 would be suspended if they completed it as ordered. The next is with the New China Royale, where employees at the facilities were seen not wearing adequate face coverings. And we had a hearing for this one because they already had a consent order. And so as our policy is, the first violation is a consent order, the second one is a hearing. And the hearing officer found that they were in violation and that they should be fined $500 for the violation. And then the last one that we have is with Cozy Apartments LLC. They have own 2 apartments in which we have issued a notice in demand to address the lead poisoning or the lead hazards that were conducive to lead poisoning. They failed to comply with the notice in demand. So the hearing officer said that they should be fined $2,000 per residence. The respondent should be ordered to keep the unit at 40 Parker Street unoccupied. It's currently unoccupied until abatement has occurred. Also, the respondent should be ordered to not allow any children to reside at the unit at 38 Parker Street until abatement has occurred. And the $4,000 fine is due and payable within 5 days. Now, I do want to make some comment on this last one. So if we don't have any comments on all the others, if we can maybe vote on that, and then I can talk about the last one. Any questions or anything on all of them except the last one?
So I have a question on the first one regarding the facility that sold the flavored vaping product. Was the violation the flavored vaping product being sold, or was it something else?
Yeah, flavored vaping products are no longer allowed to be sold in New York State.
Okay, thanks.
And the flavors they had were amazing. Bubblegum, mango, cherry. So clearly it appears that, this is a product that might be interesting to young people.
Yeah, right. That's clear. Interesting.
Yeah, and if I may ask, Elaine, what the fine for the Chinese restaurant? This was a second offense, as I understand, but
correct.
The fine was $500 instead of $1,000.
I requested $1,000. The hearing officer felt that $500 was appropriate. They spoke on their own behalf, and that was the hearing officer's decision. So,
okay, very good. Thank you.
So I'm going to make a motion to accept the claims.
Yeah, I'll second.
Anybody opposed?
No.
Okay, thank you. And now to the last one.
The last one, and I had called Rich Graham, but I haven't heard back from him, and I don't see him on this call. But the hearing officer's decision that the respondent should be ordered to not allow children to reside at 38 Parker Street, I don't think that is legal. I think you can't discriminate against having children in an apartment. So I would ask the board to instead modify that one to say that they need to have abatement to be completed within 60 days. as opposed to not allow children to reside at the unit until abatement has occurred.
Do you know what the?
Eileen, I've got a question. Oh, sorry.
I'm just wondering, out of curiosity, what does the abatement entail in this case? Like chipping and painting and scraping and things like that, or?
It's more significant, actually, replacement of windows. So there is an expense, that's for sure.
Maybe they could do one and then move them to the other place.
Well, right now, the one is vacant.
Right. They could
40.
do the vacant one and then move the occupants to that one while the other one's getting fixed. Because I would
Right.
think that actual construction, moving windows around, would create dust, which would be more hazardous than anything. Right.
Currently, there are no children living in the building at all right now.
That's what I was gonna ask.
Yeah, there are no children. And that's why I think the hearing officer said that they shouldn't allow children to move in until the job is done. But I don't really think that that is allowed in New York State. I mean, that was my concern. And like I said, I did reach out to Rich Graham and I haven't heard back.
Aileen, what position would the health if they move children in before it was done? What would the position
Pardon?
of the department be if they moved children in before it was done, though?
I guess we would take additional action against them. You know, they would, yeah.
Eileen, I've got a question concerning the certification. Was this apartment or is this apartment certified for occupancy?
I don't know whether the city of Auburn has issued a certificate of occupancy. I would imagine that they had at one point. I don't know if the certificate is current or if it's expired or not.
Well, what I'm curious about is if it is certified, how did it get certified under these conditions?
Yeah, and I don't know whether, like I said, I don't know whether they do have a certificate of occupancy or not.
Is that required for occupancy in the city? My understanding is that it is.
The city's supposed to, I believe, every 3 years or every 4 years, they're supposed to reissue certificate of occupancies for apartments, and they are supposed to do inspection of the property. And chipping paint is a code violation. So, but I don't know. Like, I can't answer your question. I just don't know if they've issued a certificate of occupancy recently or if it's expired.
I'm asking because it seems that the problem starts with that, allowing people to live in conditions like that. And I would hope that once this is settled, that there's a redoubled effort to really inspect these homes and make sure that they are fit for human occupancy. This is an issue, not only is it terrible for the people and the children especially involved, but it's a cost for the entire society. And I think it's completely unacceptable.
Right. And, you know, before COVID all happened, we did have a task force group, and the city was part of that to look at a lot of issues such as that. But we haven't met in over a year due to COVID.
Eileen, are you concerned that legally this will be challenged if the language is left in that children should not reside there till abatement, which makes perfect sense?
I am a little worried about that, yes.
Is it smarter to wait till Rich weighs in before we remove that?
We can.
Well,
I mean, I guess what I'm looking for maybe is a date on that. Maybe a date until abatement has occurred instead of, you know, maybe just saying
so
the abatement needs to be completed in 2 days.
you want a timeline to have the abatement done, and then, because children technically shouldn't move in unless it's lead safe anyways.
Exactly.
Really saying don't leave it undone for 2.5 years. And yet adults shouldn't be living there really either. No one should be if there's a lead poisoning problem, but it's particularly children.
I think a date is very appropriate to have a date on there. I mean, there's a date for all the other stuff, the septic and everything else. Why shouldn't there be a date? I just looked at it. There's no date on there. Is that something we can add?
Yeah, you can modify that. So yes, if we could add, so that's what I would be requesting, to add abatement be completed within 30 days.
I think somebody's phone's ringing. I think it's wise to make sure that we're meeting the legal standards, because there's going to be challenge on those grounds. Have you discussed this with the attorney for the city and the county, excuse me, to see what the appropriate legal standards are? I agree with you completely. I just want to make sure that we're crossing all our T's and dotting our I's.
So I have reached out to Rich Graham. I have not heard back.
Has our past practice been to put a date on things, Eileen?
Yeah.
Can we, as the board, request that a date get put on there of either 30 or 60 days?
Yes, the Board of Health can modify the hearing officer's determination.
Pending also approval from the county attorney. So
Great.
if those two, if Rich says it's okay, then we put like a 60-day clause on there. 30 days is a little tight. I know I've had trouble to paint my closet in less than 30 days, but 60 days might work.
Well, if I may suggest, this is Keith, because since we really don't know how extensive the repairs are, if I may suggest, why don't we put, I like the idea of a date. Why don't we put a decision that that the repairs be completed within 60 days pending or subject to the an appeal by the owner to the Board of Health, so that if there is a reason that it has to be longer than 60 days, we don't find ourselves in a box. Would that work?
Yeah, I think that's reasonable.
And leave silent all issues related to rent or having children occupy.
I like the idea of saying, yeah, I understand that we best not order something because we might run legal problems. I think we can say the given the extreme the potential extreme impact on children, that it was the Board of Health's recommendation and the strong recommendation that no children be allowed to reside in the unit until abatement has occurred.
Yeah.
Or some such thing. I mean, I think that's absolutely safe legally. But yeah, I see Eileen's. I don't know. It does seem like you can't discriminate based upon age. So in this case, is there there's a public health though, or is there a regulation about children living in what's considered an unsafe environment, which certainly lead would be? Is there any such public health law?
No, most housing issues are code enforcement issues.
Okay.
So this is one of the few housing issues that is a public health issue.
Yeah, of course, because this is one of the things we talked about in the lead task force.
Yeah, I think the only regulation is a poison child cannot move into another place until we've inspected it to be lead safe. Is that correct, Eileen?
Not necessarily. It's only if the child is chelated in a hospital setting, then the physicians will not release a child into a place that is not safe.
That's right.
In terms of.
So, as the board, can we say that it would be preferable to leave this premises vacant until the place is repaired? Because it's really putting anybody who lives there at some risk.
Well, right now there's somebody living in apartment 38. Nobody's living in apartment 40. So that's why he said the ordered to keep apartment 40 unoccupied. So that's already been ordered, or that's already the hearing officer's decision. So it's the other one where people are living in. Apparently, he testified that there were no children currently in 38 Parker Street.
Okay, so
Has the respondent already agreed to this plan? I mean, if they've already agreed to the no children thing, then we're probably done until 60 days and they can get it fixed. If they've already agreed to it.
Well, they were at the hearing.
Yeah. And if they didn't object, then that's almost implying that they consent to that. I mean, I don't know how far we have to push the legal thing if they're in agreement that they're going to get it fixed in 60 days. They were at the hearing. The hearing said don't have children there. They didn't object to that. We don't know what the family situation is. If it's a stable tenant with no children, then we might be putting too much effort into this.
I'm curious how you prevent a tenant, if the apartment is allowed to be occupied, how do you prevent a tenant from bringing anyone he wishes as long as it's, within the boundaries of what's authorized? If they decide I'm going to have my child or my niece or nephew or grandchild come and stay with me, how do you prevent that?
Right. It's impossible, really. So that's why I thought if we can just put a date, then it'll be, if they comply, it will be done in 60 days and this whole issue will be a moot point.
I agree with that.
do you need a
that
motion?
seems like a good plan.
Elaine, do you need a motion then?
Yeah.
So I'd move to make a motion. I'd move to put a date on there that the apartment shall remain vacant for the 60 days until the appropriate repairs are made.
I will
That it
second.
That it should remain vacant, or that the repairs should be completed in 60 days?
Yeah, because one's vacant, one isn't.
Yeah.
So I would move that the existing vacant apartment remain vacant until it's repaired.
Then repairs be completed within 60 days.
I'm in agreement with Cassie.
I would second that.
Any opposed? Okay, so moved.
Okay. A couple other things real quick, because I know that there's still a lot to discuss. Just to let the board know that we received a call from DEC on March 7th, which was a Sunday, regarding a manure spill that occurred at the Ashland Farm in the town of Ledyard. Apparently manure overtopped their lagoon. The discharge was noticed by farm personnel, who then contacted DEC. DEC reported to us that the discharge was stopped within a few hours after they were notified. It is not known for sure how much manure was released. However, it's thought to be significant. The discharge entered an unnamed tributary and eventually reached Great Gully Creek. To bring the level of manure down in that manure lagoon, the farm has been transferring manure to storage lagoons on neighboring farms and has been spreading manure on low-risk fields in the area and on their farm. So DEC is completing the investigation and they will be initiating enforcement action regarding this violation. Any questions on that?
So at this point, we don't have much information as to how this happened, right? I mean, was this influenced by a heavy rain event or a melt event? We don't know.
No, I don't. It was not. Apparently, they just had full capacity and they just let it. Apparently, it just overflowed. It was not impacted by a weather event.
Is this a large farm, Aileen?
It's a KFO.
Yeah, okay.
So, and then can you be sure to let us know what the fine is when it's levied?
Sure, it might be a year from now.
Yeah,
It doesn't
problem.
the enforcement process is. But yes, I will let the board know.
Any sense?
Any other
Sorry to
questions
interrupt.
on that?
Any sense as to how long it would take DEC to, come up with information?
In terms of the enforcement?
No, in terms of the information regarding, how this happened, to me, it sounds like mismanagement, given that there is no sort of other event that would influence it.
Yeah, and I think that that was the sense that DEC gave us. That it was not managed properly.
Okay.
And I mean, the reason that the fine, and maybe you ought to reach out. I don't know if it's appropriate to reach out to DEC or not, but the people. I mean, I haven't heard a lot of people talking about this, but I have heard some comments about it, and the comments are stuff like this wasn't an accident, it was mismanagement, and of course, will they get a fine? No, they'll get a slap on the wrist, a few $1,000s. And there is a big difference between, I don't know the facts, so won't be clear on that. But if the investigation indicates that it really is just negligence, there's a big difference between that and an accident or something that occurs because of an unexpected rain event or melt or whatever. And I would hope that DEC will be aware of those differences. And, that might be something to communicate to them, that people are aware of this, and local people anyway, and kind of are watching to see what they do.
Yeah, and I think from our conversation with DEC, I think they're aware of the concern in by the public.
I think one of the things that's concerning to me about this is also the time of year when, the temperatures change, snow melts, and we typically expect to see rain events and runoff events. And if the lagoon is already at the point where it's brimming, I mean, it's a recipe for disaster. And I guess that it sort of suggests to me that there's a level of I don't care here.
Yeah, and it's hard for me to say because we haven't had any of the discussions with the farm, but I know that the DEC is taking this very seriously, is what they told us. They're very concerned about this event. And, concerned about all spill events, actually. So we had a lengthy conversation. And so I believe that they're going to take significant enforcement action based upon what they told us.
Okay,
Any
thank
other
you.
questions? Okay, and that's all for me. Thanks.
All righty. So thank you, Eileen. And we'll move on to Kathleen.
Thank you. So all of you should have received an email toward the end of this past month after our February meeting with a slate of candidates the nominating committee put forward as officers for our Board of Health moving forward, and that to repeat those nominations and then to open it for other potential candidates. What is proposed is for the president position, Keith Batman, for the vice president position, Dr. Kosachev, and for the secretary position, Tim Fessenden. Are there other people or other suggestions? And if there are not, at this point, I would ask for someone to make a motion, and then I'd prefer a roll call vote if that's acceptable to all of you.
Cassie Archer, I motion to approve.
If all the candidates are willing, Broadridge will approve.
Definitely approve. Are we voting on all three or individually?
I would like to as a slate, if there are no other nominations to bring forward. So we have Dr. Archer and Dr. Blended. Dr. Kosachev, how would you vote?
I would vote, but it's a self-interest thing too, isn't it? If I vote, so I guess I wasn't really sure that I was really allowed to vote. I would certainly support the candidacy of Mr. Fessenden and Mr. Batman. How about that?
That sounds good. Yeah. Susan Bailey?
I would support the slate.
Great, thank you. Tim Fessenden?
I would approve the slate.
Okay. Keith Batman?
Yes.
Ralph Batista? Did we ask you already? I think we did.
I said I approve, but yes, officially I do approve of all three.
Very good. 1, 2, 3.
Everyone voted for themselves except you, Dr. Kozakov. You're the mom.
And I don't know if it's self-interest or,
Right. Modest.
Yeah. Well, he knows that the that's the only office that's paid. That's why he had to think.
Well, and again, thank you to all of you who held the officer positions this past year. It's been quite a very active year, and all of you as a board, and we appreciate all of you moving forward in these new positions that will take effect after the end of this meeting. So our new officers will be in place. So thank you for the officers. COVID-19 updates. So just very briefly, we continue to perform vaccination clinics. And we are at the Finger Lakes Mall. Currently, that's working out really well. There's been an expansion of eligibility. So we're pleased for that, right? We know that the guidance, changes all the time. The eligibility is changing frequently, but certainly any of you as board members, I'm drawing some assumptions, but you probably all qualify. So if you haven't had a vaccination at this point and you're interested, we'd love for our health department to perform that for you. So let us know, and we'll schedule you into a clinic. We are still getting Moderna. What we're hearing from the state is we should anticipate through the month of April about the same amount as we've been getting, which is on average about 300 doses a week. We are capable of doing more, certainly, but that's what we're getting, and we'll make use of that. There may be an introduction of the Johnson & Johnson, or Janssen, it also goes by, which is the 1-dose vaccine. Should we receive an allotment of that? I know Nancy Purdy is going to speak more to this, but she's been working closely with a number of entities through our farm worker world that I think will be very beneficial if we're able to do some mobile clinics to assist our farm community. As well as anything beyond that. Certainly we would use at our regular clinics. So what else can I tell you regarding clinics? It's just always a lot of information. But one of the big topics, and I'm glad Dr. Joya is still here. As you all probably know, the CDC made some revised recommendations for school-age children as far as distancing in classrooms. If you're okay with it, I'd like to ask Dr. Joya to speak a little bit to some of the research that he's done. We know there's a lot of interest in our community about recommendations that would come forward through the health department. At this point in time, just to preface before I open this to Dr. Joya, New York State is we're being told New York State's looking at the CDC guidance, but they have not issued revised recommendations at this point in time. I am aware that Onondaga County is going to accept CDC recommendations. Madison County and Oswego County at this point are not looking to change anything. Part of that's due to their timing with their board meetings, but also they're awaiting some New York State guidance. We've had some internal discussions about different pros and cons, but we really want to have some discussion from the board after we hear a little bit more of the evidence that we have and the science that we have to work from. So Dr. Joya, could you speak a little bit to some of the research that you've been able to look into?
I was just reviewing the CDC press release from March 19th on the school recommendations, and the gist of it is that for elementary schools, 3 feet apart is, as long as the students wear masks, is okay. For any rate of exposure or caseload in the community. Whereas for the middle school and high schools, if there's a high risk of transmission, the rates are at 100 per 100,000 or more, as is Onondaga County at the present time, but not Yucca County. Onondaga is about 120, and Yucca County is, I think, around 50 or so. Last I checked, and then the high school students can go to school, but they have to have 6 feet apart and wear masks too. And then, of course, all the quarantine and the checking, and if you're ill, you're still not supposed to go to school, which sounds pretty reasonable. And the MMWR, the morbidity and mortality review that the CDC puts out weekly, they publish the basis of their findings, had to do with analysis of schools in Florida and a school in Utah, some school districts in Utah. Show that there's pretty low risk in elementary schools, regardless of the rates in the community, but especially high schoolers and middle schoolers, especially when they're socializing, is higher risks than schools. Things like wrestling tournaments in Florida was especially high risk, and contact sports like football was more of a risk, especially when you're having like tournaments and interscholastic sports. Sounds reasonable. Again, the best thing is getting the rates down in the community and keeping up with the vaccinations. You got the Janssen or Johnson should be coming out, and then probably by May or June we'll have the Novavax vaccine will be out, and they probably on the AstraZeneca will probably be approved by May, though they're still trying to go over the final analysis. The initial analysis looked pretty good. It just came out, but they thought maybe they didn't include enough of the recent data, which was not as favorable as the older data. But it's still probably be better than nothing. It'll help decrease the high risk or the high morbidity or mortality or the deaths and intensive care hospitalizations, which is always nice to do, but you still may have some sick people, but not as sick as they would be if they didn't get the vaccine. Any questions?
Well, is our purpose now, as the board, is our purpose to change recommendations to the school district? Is that what we're discussing? Whether we're going to make a formal stance on 3 feet versus 6 feet, essentially?
That certainly is a consideration that could be offered. So I know that we have received a number of comments and inquiries from the various school districts within our county. There's a lot of desire, and that's no secret, that schools want to be able to bring their students back safely into the classroom on a daily basis if possible. The CDC release of information certainly brought that forward even more. I think there are a lot of considerations, and it's not one that we want to take lightly. So I guess I wanted to bring this forward, not only to get your opinions at this point in time, to have something, I want to be able to let the schools know that we are taking their concerns seriously and giving them the consideration that they merit. I don't know how long it will take for New York State to make any alteration to their guidance if they're going to do so. There's no timeline around that.
Are you hearing any resistance from them, like the rationale for them not accepting the CDC recommendations now? Is that being discussed?
Unfortunately, I don't get any feedback on that. All I'm getting the feedback on is that it is being discussed. And honestly, I couldn't tell you whether that's through state health or whether that's through the state governor's office and in combination with the health department. Our association of health officials is communicating with state health people to say that, yes, we know this is out there, that there should be, there's going to be consideration. And I will also tell you, last week, in anticipation of the CDC releasing this, it's kind of across the board amongst health departments as well at this point in time. That's why I sent you, for example, the Erie County considerations and questions they had about some of the recommendations that CDC had come forward with. We know right now our rates are low in this county, and we're pleased about that. We don't know what variants may bring. We don't know what the future may bring. We also are aware that there are a number of people looking to take advantage of the benefit of lower rates, and some people having vaccinations. And we've been hearing that there are going to be a number of travelers during the school vacation. That concerns us, that people will be traveling elsewhere and then coming back to school. So I think there's a little bit of reluctance, certainly initially, if there is going to be any recommendation coming from this department, this board. At minimum, we would want to wait until 2 weeks after the return to school. Again, if that's even the direction that is desired to be considered at this point.
I think that oh, sorry, go ahead.
Go ahead.
Oh, I think that we're not going to be able to find the scientific data that doesn't have the biases which were pointed out from Erie County. And unfortunately, because of the way this happened, we don't have the luxury, I think, of getting that type of data, which would be the strongest scientific basis for that. That being said, I am seeing more and more children in my office who are having significant social and emotional and developmental ramifications of the fact that they have not been in school for a year. And I think that we don't really have the luxury of waiting for that data. And I think we need to really seriously consider following the CDC guidelines 2 weeks after the spring break travel time to allow kids at least 6 weeks of reacclimating under this circumstances, which will probably not be an academic benefit, but will be, like I said, a significant social and psychological and emotional benefit.
Yeah, I was going to say something similar, that the data is not perfect, but I don't know that we're going to be able to get perfect data. And everything has its flaws, but all things being considered, it seems like the transmission rates with shorter distances for elementary students seems to be not be elevated. So it sort of supports the idea of being able to have kids come back to school at greater densities than we were originally recommended. And the bottom line is, as new information gets put out there, as new variants maybe make their way across the country, this might all end up changing, but I think for now it's looking like it is reasonable to consider allowing the schools to open up again, and I would support it.
I agree with the doctors. Excuse me, Brian, go ahead.
Well, I have a very similar take on it. Both are risky. Having kids close together, tight packed in school is risky, and it's also very bad for them socially and academically, and for the future of our whole society to have big swaths of uneducated people and people with social problems and mental health problems. So we know that each side is risky, but in my opinion, the teeter-totter has shifted. At the beginning, we didn't know how this was all going to pan out. We had to be extra cautious. And now it's shifting to the fact where more and more older people are being vaccinated. The kids are kind of showing that they don't get all that sick. And it needs to be tipped in favor of letting the kids go to school at this point So I am also in favor of following the CDC recommendations.
I don't disagree with any of what's been said so far. I do. Dr. Archer makes an excellent point. There's a lot of other impact from not being able to get back to what's normal, especially for children. So I think that's important. And I think that's very wise to wait till after spring break, give a couple of weeks to allow any potential surge to hopefully make its way through, any population that might have been affected. I do worry about being so close to the finish line after we've gone through all of this. It's been a whole year and we've gone through a lot. Let's not blow it at the very end. Let's try to get through the end.
When is the end? We can keep pushing this back for a long time. We can say the same thing next fall. We're so close to the end,
We could have done the same thing, Brian. We could have done what Sweden did and said, just, whatever happens, happens. And we could have done that, but we didn't. We chose to lock down. We chose to try to get a handle of this. And now we're at vaccination. And I'm hoping, and I know it's a very complex issue, especially with the politics of this situation. But I do think that once we're finally getting to a level of vaccination for hopefully the majority of people, that we're not going to have another surge unnecessarily. But I say that only as a word of caution.
I just would have one curious question. If the surge that no one wants to see was to happen and the positivity rate increases, is part of the CDC's recommendation that this wouldn't be allowed anyway? Yes? Oh, okay.
It goes back to 6 feet for the even for the elementary.
Based on positivity rate?
Yeah.
Okay.
No, it goes back to 6 feet for the high schoolers. And of course, then if it gets really bad, you'll have to readjust. But hopefully, with the vaccinations and the better weather, things that are always good, but it's not mandatory, is increasing the ventilation, fresh air, outdoor stuff when you can. Those all help too.
The 3 feet is just for elementary, or I thought 6 feet was going to stay with the high school and the older kids anyway.
Right. Yeah, just for high school and the middle school.
Okay.
It doesn't say where they cut off for middle school. It varies kind of the district and stuff. But the elementary school, they're not going to worry about the rate at this present time. Though, what had happened before is when you get a really high rate of infections in the community, you don't have the teachers to staff the school like we had in January. It wasn't that bad for the kids, but we didn't have the teachers to be.
Gotcha. Yep.
And you can always, and nobody's saying that you should eliminate the distance learning. That can be a great option for especially kids that are high risk for infection or families that have high risk people. So,
Or really anybody with allergies who's going to be symptomatic.
And in the interest of trying to help with the scientific nature of this, if the health department could support the school systems for surveillance testing, at least within the staff and maybe within a certain subset of the children, we would be able to start to see an uptick prior to a surge.
Yep.
I'm wondering why can't we at least accompany that with rapid testing, try to keep some sort of idea of what's going on in the schools.
Yeah, rapid testing is nice for the time element, but it may not be as sensitive. So that's the only limit on the rapid testing right now.
Well, I understand that, but it's so invasive to have the more accurate test. But at least the rapid test gives you a good idea what's happening.
You can always do both. That's we do have the availability, and practically in Auburn, you'd even do a regular test. It's usually back in 24 hours, so it's it's not as slow as it used to be for sure.
Right.
Well, it seems like a big part of the pandemic and our response to it has been hampered by the lack of testing. I'm thinking that if we had much more testing, even if it wasn't quite as accurate, but at least have an understanding where the clusters were, where the infections were spreading, and if we could do something like that, even at this late stage, especially when children are involved, if we could try to quash any outbreak while it's still going, while it's just starting up before it gets too out of hand, that I think that would be helpful.
Also, you need like a rapid response data analysis and system, which is, even though the state has electronic data submission, it's kind of disjointed and not always connected to local districts and local health departments.
Our testing availability has been limited, though, as far as getting supplies, and I don't know, that can change. Maybe, I don't know whether the state will have any more resources to be able to provide us.
So maybe this was already answered, but are we capable of seeing our own data in a real-time basis? So the testing that we do as a county, can we see that data on a timely basis?
It varies, and Nancy, you could probably speak a little better to me. So it depends the type of test done. So if we do the Binax rapid test cards, they have to be up. It's ready in 15 minutes, and they get up. Everything's supposed to be uploaded within 24 hours of receiving it. But depending, so that's your rapid test. But the ones that take a little bit longer analysis, we're going to see the positives. We're not probably necessarily going to have a sense out of what percentage tested, right? Until we see somebody else doing that analysis for us. And that's the state doing, showing us where we're at with our testing rates.
So based on what you're saying, we get feedback on the number of positives, but we don't really actually know what the denominator is, right? How many tests are actually being done by the various places that are involved doing the testing.
Not always. Like again, everyone who tests is supposed to upload it, but there could be 100 tests on one day. There could be 1,000 tests on one day. We wouldn't know that until really it's looking at the state data off the apps that we get or off the links that tell us the percentage of positivity.
Okay, thanks.
Are you asking if the board would vote on whether adopting the CDC regulations or their guidance? Is that where we're at?
Well, I really, that certainly is something that could be considered. And I don't know if the board's prepared to do are great.
But I would say that it sounds like the board supports the CDC's recommendations, but
I would be willing to put out a motion to accept the CDC's recommendation. I like Cassie's idea of waiting till after the break. And I also very much respect the other thing that Cassie said was that will give kids about 6 weeks of socialization improvement before summer, which I think is quite helpful and important. So I would make that motion if anybody else wants to go along with that.
I'll support it.
Okay. I'm in.
May I ask a couple questions before we vote?
Okay.
Thank you. So my first question is: does this vote have any meaning? Aren't we bound by the state state recommendations, or no? So, Kathleen, can you act independently of the New York State Health Department on this issue?
So we can. We're home rule, right? Is there going to be some reaction? I guess that remains to be seen. I'm not certain how New York State Department of Health will react to this. And I don't know. Yeah, I guess that's the best answer. I don't know.
Okay. That was, yeah, I didn't realize that we could act independently on this. So why can we not have our own mask rules then? Why cannot we do?
There's executive orders and then there's guidance.
Okay. Okay, gotcha. I do understand the difference. Okay, thank you.
Mary Elaine, you were starting to say something.
No, I think that answered it. That basically the reason you have discretion Onondaga is taking those recommendations. Other smaller counties were waiting to consult with their Board of Health, I heard you say. And this is guidance, therefore we have some ability to accept the guidance or indifferent based on CDC, right?
Right. We'd want to base it on something. We wouldn't want to be get out of here.
Yeah. Well,
Okay.
I defer to the experts among us, so that if you guys that know more about this than I think that that it makes sense, then yeah, I can support it.
Good afternoon, everyone. So this is Aileen. I've been on the call too. It's important for me to gauge how this board is reacting to this change so that Kathleen and I can take this information back to the superintendents and have a meaningful conversation about what's ahead. I feel very strongly that we do wait post vacation to be sure there isn't a spike so that we set this off on the right foot. So I agree wholeheartedly with what's been said here today. So I'm happy that folks are weighing in on it. As Keith had said, you are the experts, and I definitely defer to you and your judgment on this. So Kathleen, I think we should set up a meeting with the superintendents for discussion and see, just gauge their preparedness. I know they were only a few were prepared to go ahead with barriers when barriers were, the mandate or the suggestion. Now it seems to be more free. They are going to be dealing with teachers' unions and some other issues that we don't have to deal with, but we definitely want to have that conversation. So thank you.
So as I understand it, at this point in time, and again, everything's always subject to change as we get new information or additional information. And I guess I'll ask all of you, again, I'll probably do a roll call just so everyone has a chance to weigh in on their opinion here. But right now, at waiting 2 weeks after the district school breaks, so that means 19 being that first in-school day, but there is support for the CDC recommendations for return to classroom from our Board of Health. Does that sound like I have summarized that correctly? And Dr. Archer, could you, I know.
Yeah, except I thought the idea was to wait until after break to see if there was a surge. You're not going to know that the first day back, right? Shouldn't it be a week after that?
So the 19th would be 2 weeks after the return to school.
2 weeks after return? Okay,
Correct.
thank you. That shows how on top of spring break I am. Thank you.
Go to Miami. They're having a great time down there.
Yeah.
Aye.
Okay. Dr. Brundage,
Yes, aye.
Dr. Kopica,
I support it.
Elaine Daly,
Yes.
Jim Fessenden,
Yes.
Keith Batman,
Yes.
Ralph Batista,
Yes.
and Dr. Joy, I know you've kind of weighed in on some of this. Did you have any other thoughts, at this point?
Sounds like it's reasonable. Wait to see how the effective vacation is, and getting more vaccination should be helpful. By then, a lot of good things, more fresh air stuff. So it sounds reasonable.
Okay. And Haley, Deb Coleman and I will set up something to have a discussion with our superintendents to talk about this meeting and this proposal. So, thank you. And I know it's a challenge. I guess I'll stop talking at the moment.
Thank you, Kathleen. All right, Nancy, I don't want to rush you, but we're sort of running out of time. Don't forget to unmute.
Good afternoon. Now, my only comment will be this discussion that was just held here, and I commend all of you. If you recall, we just discussed and updated the school guidance last month with the understanding that we would come back 90 days to discuss anything further. Always want to stay on top. Well, there was new evidence just within the last 30 days that was presented to us. And we have done so to bring forth and have this conversation, as we've done all year long with every step that we've taken and with the board's support. So thank you. That's my comments for today.
I just have one quick question. Does the school have discretion? Each school district can do, I mean, we've approved this, but it's up to them.
We do have some. And I think space is going to make a difference. And certainly, I think schools are accountable to their school boards, and some of them have taken a more conservative approach than others at times.
Alrighty. Well then, if does anybody else have anything else that they want to raise at this meeting? Okay. I want to take a moment to thank everybody that I've worked with over the last several years. It's been a pleasure and it's been an honor. And I have really enjoyed serving on the board and hope to continue to do so in some capacity going forward. I will now take a motion to adjourn.
I move we adjourn.
Thank you, and we'll see you next time.
Thanks, John.
So long, everyone.